Droxidopa 300 mg capsule pressors is used to treat symptoms of low blood pressure when standing, caused by a certain medical condition, neurogenic orthostatic hypotension-NOH. This medication can lessen symptoms of low blood pressure when standing, orthostatic hypotension, such as dizziness, lightheadedness, or the feeling that you are about to black out. Droxidopa is used by people whose daily activities are severely affected by this condition, even after other treatments are used, such as support stockings, water bolus. It is thought to work by making the blood vessels become more narrow, which increases blood pressure. The recommended daily dosage is determined by your doctor and it is typically taken 3 times a day, with each dose being 100 mg. It is best to take Droxidopa at least 3 hours before you go to bed. When taking Droxidopa 300 mg capsule pressors, it is important to follow your doctor's instructions. Typically, it is taken 3 times a day, in the morning, midday, and late afternoon. You can take it with or without food, but it's important to be consistent with the way you take it. It's best to take this medication during the daytime, when you are most likely to be standing. Avoid taking it after your evening meal or less than 3 hours before bedtime. The dosage will depend on your medical condition and how you respond to the treatment. Your doctor may start you on a low dose and then gradually increase it to reduce the risk of side effects. It's important to take this medication regularly to get the most benefit from it, so try to take it at the same times each day. It's also important to note that this medication should only be continued if your symptoms are getting better. If there is no improvement or if your condition worsens, be sure to talk to your doctor. And remember, do not take this medication for longer than 2 weeks unless your doctor tells you to do so. Lastly, learn how to monitor your own blood pressure and share the results with your doctor. You may experience headache, nausea, or dizziness while taking Droxidopa 300 mg capsule pressors. If these symptoms persist or worsen, it is important to notify your doctor or pharmacist. To reduce the risk of dizziness and lightheadedness, be cautious when standing up from a sitting or lying position. Your doctor has prescribed this medication because they believe that the benefits outweigh the potential side effects. However, it's important to monitor your blood pressure, especially when lying down, as this medication can increase it, known as supine hypertension. Be sure to share your blood pressure results with your doctor and inform them if you experience symptoms of high blood pressure, such as a pounding heartbeat, pounding sound in your ears, headache, or blurred vision. In rare cases, this medication may cause symptoms similar to a condition called neuroleptic malignant syndrome, NMS. This is more likely to occur when your dose of this drug or other medications, such as levodopa, is changed. Seek immediate medical attention if you experience symptoms such as fever, muscle stiffness, severe confusion, sweating, or fast/irregular heartbeat. Although very rare, a serious allergic reaction to this drug is possible. If you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help immediately. This is not an exhaustive list of potential side effects. If you experience any other effects not mentioned here, contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you may report side effects to Health Canada at 1-866-234-2345. If you take Droxidopa 300 mg capsule pressors, it can cause your blood pressure to increase when you are lying on your back, which is known as supine hypertension. To reduce this risk, you can raise the head of your bed. Your doctor will closely monitor your blood pressure in this position before and during treatment, especially after a dosage increase. If supine hypertension occurs and cannot be managed by raising the head of your bed, your doctor may adjust or stop treatment with this medication. If supine hypertension is not managed, it could lead to a stroke, heart attack, or even death. Make sure to talk with your doctor for more details and guidance. As for the best time to take this medication and the daily dosage, please consult with your doctor to ensure you are taking it at the optimal time and in the correct amount for your specific needs. Before taking Droxidopa, it's important to let your doctor or pharmacist know if you have any allergies or if you are allergic to it. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's best to talk to your pharmacist for more details. Before starting this medication, make sure to inform your doctor or pharmacist about your medical history, especially if you have heart problems or kidney disease. Droxidopa may cause dizziness, and using alcohol or marijuana can increase this effect. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. Limiting alcoholic beverages is also recommended. If you are using marijuana, it's essential to talk to your doctor. This medication can increase your blood pressure, so to reduce the risk of high blood pressure when lying down, it's advised to raise the head of your bed, supine hypertension. Before undergoing any surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It is not known if this medication passes into breast milk, so it's crucial to consult your doctor before breastfeeding. It's important to be aware of the potential interactions between Droxidopa and other medications you may be taking. This can affect how well the medications work and may increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If someone has taken too much Droxidopa and experiences severe symptoms like fainting or difficulty breathing, they should seek immediate medical assistance by calling 911 or their local poison control center. In the U.S., residents can contact the local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. It's important not to share this medication with others. In addition to taking Droxidopa 300 mg capsule pressors, there are other ways to help manage symptoms of neurogenic orthostatic hypotension-NOH. This includes drinking plenty of fluids, taking salt supplements/table salt, or wearing an abdominal binder and leg stockings. Certain physical movements, such as toe raise, leg crossing, and thigh contraction, can also help you stay upright for a longer time. It's best to consult your doctor for more details on these methods. While taking this medication, it's important to have lab and/or medical tests, such as blood pressure, done regularly. Make sure to keep all medical and lab appointments and consult your doctor for more details on this. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the regular time. Don't take double the dose to make up for the missed one. Remember to store Droxidopa 300 mg capsule pressors at room temperature, away from light and moisture. It's important to keep them out of the bathroom and out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard the product according to the guidance of your pharmacist or local waste disposal company. And remember, don't flush the medication down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.